Hi everybody, Sonia Rollins for Chamber Spotlight. We are excited to be at Burlington Mall Road today at Keep It Moving Physical Therapy and Wellness. Join us as we talk to the ladies about all of the different things that physical therapy and massage therapy can do to keep you healthy or get you better. Join us. Ladies, I'm excited to be here. So, I was saying when I came in, it's really neat because your title has physical therapy and wellness. Talk about the marriage of those two things a little bit, if you could.
With physical therapy, you think, okay, my shoulder hurts, I need to go get it checked out. And, we can absolutely help you get out of pain. And some cases are different than others, and sometimes it takes a long time to get out of pain. Sometimes it doesn't take that long at all. But what we offer is the ability to take it the next steps further. So not only do we help you get out of pain, but also you can be more confident in getting back to the activities that you love.
And when you say when they're in pain, when is that point when someone thinks, I really should come and see somebody in a place like this?
When you first experience pain, if it doesn't go away in a couple of days and then you start to notice that it's prohibiting you from doing certain movements, activities, that's when you should come. Britt or Kalila, the physical therapist of the practice, will come in, do a full body evaluation, and really fine tune the things that need to be worked on. And then you come back weekly, bi-weekly, whatever you need, and work on those things and essentially get better, out of pain, stronger, more resilient, and educated too. Because it's important for you to know what's going on and why, and what you can do to be in control of your pain.
Sometimes people think the first line of action is their doctor, right? So they're going to go to their doctor, they're going to tell them they have this pain, and then they're going to be referred to a physical therapist. If I'm hearing you correctly, if people are starting to feel a pain that doesn't feel quite right, they can come to you first.
Absolutely. So Massachusetts is a direct access state. And so what that means is any person can go to a licensed doctor of physical therapy to get evaluated without having to see their doctor, their primary care physician, or a specialist or an orthopedist. And I think that's a misconception, that they think that they need to wait however many weeks it takes to sometimes see their primary to get that referral, that stamp of approval to then come see us. We're direct access. So you can wake up and have a certain pain that you want identified, and you can call us and you can come in, day of, as long as we have availability.
Talk about how massage therapy really helps not only prevent needing physical therapy, but also marries with it.
So the massage therapy that we practice here, we call it like orthopedic. So I blend my physical therapy experience with my 11 years of massage therapy experience, and we talk. I get your history, what's going on now, and anything else that you may have forgotten that comes up that's going to give me the details to better understand your body and provide that treatment. That way we can have that discussion of what I think is happening, how it correlates to your pain, and other ways that you are perhaps inhibited from certain things. And then blending the two is like, okay, great, I'm glad that you're out of pain, you feel better now, you're more mobile, but how do we keep this? Because massage isn't going to just keep this. So that's where the blend of the physical therapy comes into play.
Ladies, talk to me about there's always different areas of physical therapy that are either coming forward or something that people are paying attention to more. Talk about some of the specialties you have in here.
A specialty we have here besides orthopedic physical therapy is that we also practice pelvic floor physical therapy. Yeah. So Kalila is our pelvic floor PT, and her and I then co-treat with their pelvic health program. So we address issues such as incontinence, breathing dysfunction, painful sex, any type of leaking, diastasis, which is abdominal separation during pregnancy. We help with prenatal rehab, postnatal rehab. If you want to just stay strong through your pregnancy, any type of pregnant demographic is who we work with to just kind of bring more awareness to the pelvic floor world, because it is an underserved demographic.
I think there's something really important to be said in that sometimes some of these things are almost perceived as embarrassing, right, a shame. I can't say that because that's not a normal thing for people, but what you're saying is, even things that feel like, should this be happening or is this normal to happen, that's something they could come to you on.
Yeah, absolutely. It's like these things do happen to our bodies as we age or go through pregnancy or the postpartum experience. It's it's normal, but we can treat it.
Okay.
It's not something you have to live with.
I hope you enjoyed our time at Keep It Moving today as much as I did. If anything, we've learned that physical therapy is so much more than just an injury. It's about keeping your body healthy, keeping it moving, and making sure that you take care of yourself before, after, and during any injuries. For Chamber Spotlight, I'm Sonia Rollins.